Welcome to the Commissioner meeting for Monday, May 20th, 2024. We'll start our meeting with the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, first item on the agenda today is Scott Wagner with our health department.
So I'll introduce Darcy. Darcy is our community health nurse, and she has some information for you about Americorp, American Heart Association.
Start from the top.
Darcy has some information for you about intern grant that she received, and she would be best to answer your questions on that. Again, this is a fully paid, fully funded, doesn't go through our payroll, and the county actually gets a small stipend for any offsetting any cost we might have in housing that person.
And I'll just share a little bit of information about why this came forth. I have a lot of health initiatives that I want to work on, and I can't do them all at one time. And I believe this was presented through the health or through the state, and it's just an opportunity for a member through the Heart Corps and the American Heart Association to work with the county on some health initiatives for heart health. So they would work on being able to teach individuals how to use their blood pressure cuffs, knowing what a normal blood pressure reading is, work with the food banks on helping the food banks pull foods that are low salt, low sodium, so that individuals that maybe have a diagnosis of congestive heart failure are getting an appropriate resources. They could help set up health fairs. This individual would be trained to teach CPR. They could teach that anywhere throughout the county. I mean, just really anything heart related. And I've got so much to learn in my position. I'm not ready to even tackle that piece. So I thought maybe if we could have someone work on that for this next year, then I could take that over when they're done. So I don't know if you guys have any questions. I just kind of summarized what they'd be able to do. And then they do have to be 18. They have to be a high school graduate. They would be HIPAA trained. They would have an FBI background check. They would have a sex offender background check. They would not be drug screened. So if we would want to do that, that would be our cost. They would receive a twice monthly or every 2 week stipend from the American Heart Association. They would have their own uniform, their own laptop from the American Heart Association, mileage reimbursement. They get their own health, dental, mental, and vision insurance through the American Heart Association, and their own liability insurance. So none of that is on us. They would really be working as a volunteer for the county. What questions can I answer?
Is this an annual grant that they do every year?
This is the first time it's been presented to Indiana, but it can be. Some of the states that have used it, some of the rural states, this will be their second or third year. And I don't necessarily know that it's something that we would want to apply for again. I just like the idea of having someone that can work on heart health for us.
And Andy, have you looked at the grant application?
I have.
Anything else?
Yeah, the agreement is really between Americorp and the American Heart Association. The county's agreeing to kind of provide some oversight of the member and some training. And the only thing I did to the agreement was I added in a paragraph to make it clear that the member was not an employee of the county. So I just put that in there. And the agreement that we have specifically says this is not for signature. So we're just agreeing on the agreement and we send it back to them and they'll circulate a final draft.
Okay.
And how many hours a week would they be with you?
They could, it's open, it can either be 25 hours a week or 40 hours a week.
I have no
And
concerns.
I'm kind of looking at some of the universities that are within driving distance because, you know, it might be a nursing student or a public health student that would maybe want to work 25 hours a week. So they could still continue with classes. They would get a large stipend at the end to pay for their next semester. So there would be, I mean, it would average out to about $15 an hour. That's what they would get, but then when they get done with the year, then they would get about $7,500 to $8,000 for the next semester of school.
When you said they would start.
They would start with us in October. They would have 2 weeks of intense training with the American Heart Association.
So Andy, we're just agreeing to get a final contract when we send back your red line.
Yes.
And they're gonna send it, and then we'll talk about it again in our next meeting.
I think you could approve it now with my changes. And then if they agree to it, we can just, Chad could just sign it when it comes in. Because this is, we have the agreement. It just says this is the draft is for review and discussion only, not for signature. It says when the parties are ready to sign, they will circulate a signature for each one. So you could approve it today if you wanted to, or you could wait till it comes next meeting.
I'd make a motion to allow us to have an intern from the American Heart Association. And have Chairman Banks sign the contract.
Okay, I have a motion and a second. Is there any further discussion? Hearing none, I'll call for the vote. All those in favor, raise your right hand. And opposed, the same, and that passes unanimously.
If you want to go to the personnel committee.
Well, I don't know why we would need to, because it's not, we're not adding an employee. Yeah, it's just.
The other thing, additional to that is housing that person. I have talked with maintenance about, they have some equipment already here that we don't have to pay for to make a cubicle in our back space for that. But additionally, then to talk about the other grant. So the other grant, the Preparedness grant, so September 11th, when they had the terrorist attacks, the federal government came out with a grant called Preparedness Grant, or British Violent Terrorism. So we have taken that grant from its inception since 2004, 20 years. Heather did the first 10 years, I did the last 10 years. That involves the Healthcare Coalition. Until last year, basically you signed on to that, you can hire somebody to do the grant. Basically what we did, we took the grant and we would buy equipment, training, whatever for emergency management for us for preparedness. That's how we got the trailers, several of the trailers out there paid for with this grant. Last year, they started asking for a part-time person. So with an FTE of 0.5, yes, 0.5. So 20 hours a week is what they're asking for a person in this grant. I have not seen the deliverable for this year yet. However, there may be that they're going to require that. I've been able to sneak by since I've been doing it for so long. I just do the grant on my part-time basis and I can get things done. They may not allow that anymore. So I need to know if you still want me to take this grant or not. And that would actually be paid for with the grant.
And they're just overseeing the grant.
So the grant comes out and it has what they call attachment A. There's a bunch of deliverables on, mostly going to meetings, updating your plans, participating in exercises, things like that, working with emergency management. And so if we took the grant, the money would go towards paying that person instead of buying equipment, and stuff like that. The state's now changing the way they want that actual somebody in the office working on emergency management part-time at least. This last year I had to do it and actually have Heather be the backup, so she had to take classes and training as well, which we haven't done before either. The only issue, one reason I ask is, if we do take the grant again and we have to hire somebody, I need another spot for somebody in the office. And so I'm trying to decide whether we actually renovate the back of the health department for permanent spaces, permanent cubicles, or not.
Have you talked to Amy Biggs?
Yes, I'm with it.
What does she think about that? Because I would think that that part-time position would fall under her department.
It's actually under the health department. So the State Department of Health has an emergency management branch as well as the Department of Homeland Security. And they're supposed to work together. They've done a poor job in the past, and they're getting better. There's a big movement this year to bridge that gap. I'm not sure that we would necessarily need another part-time person to do emergency management necessarily just for the county, since we're so close with the department anyway. But again, if they require to have a part-time person, I just want to bring that to you guys.
Seems like it would be a duplication of service when we're already providing that.
Do we need the grant? Like, no, we're just
Yeah,
applying
we-
for it.
we've taken, we've been one of the only towns to take it for 20 years, but like Allen County's never taken it. They're big enough, they don't really need to. But
I'm sorry, maybe you said this already. What's the amount?
$25,000. So like this year, we paid for all the rescue task force equipment and training needs, which was $22,000. But they started doing that this year. We bought like the trailers before and all the equipment that go with the trailers back in the past. On the training, things like that.
What's the deadline for the application?
Well, we're supposed to have it signed by July 1st, so I can come back next month. I just don't know when they're gonna have that out for sure. Just let you know ahead of time. I'd hate to just do, if I have to make another space, do it now, but I can just do the part-time space.
And you think of 20 hours of work for this person off the top of your head? No. So we really don't.
Well,
need
not
it.
unless they make the attachment A so large that it requires somebody in the office. So this last year was extensive.
I think I'd like a little bit more time to explore this.
So, but
So,
in the meantime, I can go ahead and have Kyle make the space for that person in October. Or do we wait on that too? Just wait.
Well, when will we know if we're approved for that grant? We should probably wait until we know.
Yeah.
Or we
When
make
they
a month.
review his-
I agree. Yeah,
Okay, we'll just wait, come back in June if they have it done.
yeah, I don't see a rush. I think there's plenty of time and plenty of space too, so. Okay.
Thank you.
Thank you.
So the next item on the agenda is the state funding for health departments. It's the Health Funds Indiana. We've had conversations about this for over a year. The deadline to opt in for 2025 is quickly approaching. It's June 1st. So this is the last time we meet before that deadline approaches. And I've had a little bit of time to, again, talk to Tyler Warman from the state, from the governor's office, as well as do some additional research and digging. I've talked to our legislators. I've talked to many people about this. And I feel that at this time, I'm comfortable with giving it a try. This is one of those things that we can opt into and then later decide that it's not right for us and opt out again. So I've had time to review it. We have a resolution that was prepared by the state of Indiana to opt in. And so, for sake of discussion, I'd like to know how we'd like to move forward.
Is there a resolution number?
It would be 2024-10.
I'm comfortable with it, knowing what you just said about being an annual basis and something that we can try. And if it doesn't fit us, then we can always talk back out in the future.
I'll add that I was very hesitant. I was very opposed when this was first presented more than a year ago, because I've forgotten the way the state handled coronavirus. And my concern was that by agreeing to this, we would be losing local control. We would be losing home rule and the ability to decide what's best for Whitley County. And in my time researching, I just don't feel that that's the case with Health Fund Indiana. So I mean, the verdict is still out. I respect Scott Wagner from the health department. I respect Dr. Burkett. I feel comfortable moving forward for 2025 with Health Fund Indiana.
Yeah, I would agree. We've discussed this heavily for over a year now. So I'm at the point that I'm comfortable, and if it doesn't work out for us, then we can opt out the year after.
So do I have a motion to approve resolution 2024-10?
Yes, I move to approve resolution 2024-10.
A second?
Have a motion and a second. I'll call for the vote. All those in favor, raise your right hand, and oppose the same, and that passes unanimously. Looks like I will go back to Andy then. The next item on the agenda, we do have a facilities requests that came in. I've not had a chance to review that, but is that the only one?
So the request is from the Whitley County Jail Ministry. And the purpose is to discuss the needs of Whitley County and how to better serve the incarcerated and the families along with deputies. Requesting to use meeting room B here in the Government Center on May 23rd, 2024 from 5:30 PM to 8:30 PM. Brian Maley submitted the request on behalf of the jail ministry.
Has maintenance been included in this request, Cammie?
Not yet.
Of course, they would need to open the, since it's after hours, they would need to be involved in opening the building. Right?
Yeah. I don't know if maintenance has code.
May 20,
Or
May
not me.
23rd.
Let's quickly approach.
Yeah, we should probably talk to them, because that's in,
That's in 3 days. I'm supportive, you know, of the initiative, and I'm okay with them using the building. I just think there's probably some more collaboration that needs to happen if we approve.
So we approve it and just take care of that afterwards. I would move to approve this request as presented.
I'll second that. I guess with the caveat that maintenance can get someone in here. I don't know why they wouldn't, but I mean, we only have a few employees.
After business hours.
Yeah.
Okay, I have a motion and a second. I'll call for the vote. All those in favor, raise your right hand, and oppose the same, and that passes unanimously. Next item on the agenda is payroll and accounts payable claims.
I went up Friday afternoon and looked through some claims. The only one I had a question was on the Durangos. Was there 3 or there were 3? Okay. So for that amount, I was a little bit sticker shock, but I reached out to Tiffany. She was going to take my call when she was out of the office. So I saw no other issues, so I will move to approve accounts payable.
Second.
Okay, I have a motion and a second to approve accounts payable. I'll call for the vote. All those in favor, raise your right hand, and that passes unanimously. Payroll.
There was no payroll on Friday.
So
I was up Friday morning,
Oh,
so
maybe
then
did
you
it.
must have came in
Okay.
for me and signed a few.
Okay.
That's what I thought. I'm like, that couldn't have been the previous one. Yeah, there were no issues with payroll. I would make a motion that we approve the payroll voucher.
Second.
okay, I have a motion and a second to approve payroll. I'll call for the vote. All those in favor, raise your right hand. That motion carries unanimously. Meeting minutes. We have 2 sets. Commissioner Freeman and I were present for a joint executive session with council on May 8th. So I would call for a motion to approve,
So moved.
and I'll second and call for the vote. All those in favor, raise your right hand, and oppose the same, and please note 1 abstention. And then we have a regular Meeting minutes from May 6th.
Minutes look fine to me, so I would move to approve minutes as presented.
Second.
Have a motion and a second. I'll call for the vote. All those in favor, raise your right hand. And opposed, the same. That passes unanimously. Anything from county attorney?
Nope.
Tiffany, anything to add? Okay, at this time, I'll open up for public comment. If anyone would like to come forward and add to today's meeting.
Good afternoon. My name is Jacob Schrader. I'm a resident of Columbia Township and the Deputy Chief of the Columbia Township Fire Department and Secretary of the Chiefs Association. And I know historically the fire departments in the county haven't been too engaged at the government level, and we kind of aim to bridge that gap a little bit. So I'm just here to introduce myself, let you know that we're here. And if you ever have any questions about the fire service in the county, what we do, why we do what we do, and some of the challenges that we face, you are more than welcome to reach out to me. I'll give you my business card before I leave. And, if there's any initiatives or projects that the county is involved in that you think may involve or need to involve the fire department, please reach out. And in the same breath, we'd like to be involved where it's appropriate. So thank you for your time.
Thank you.
Thank you.
Thanks. Good to see you.
Hi, my name is Kate Dippold. I'm the new Government Affairs Director for the Upstate Alliance of Realtors. I just wanted to come and introduce myself. Before this, I was at the Allen County Commissioner's Office as the Government Affairs Director, lobbying down at the State House for them. But I just wanted to give you guys my business cards as well and introduce myself. I've only been in the role about a month and a half, so it's a whole new world for me. So I'm still learning, but I look forward to being in touch with you all and getting to know you all.
Great, thank you.
Yeah.
Anyone else? Commissioner Basinger? Commissioner Seaman?
How was the breakfast, Jake?
Good.
I wasn't able to attend because we had a county GOP breakfast at the same time, but I was there in spirit.
No, thank you.
And then the only other thing I'd like to add, property owners in the county, myself included, have been receiving usually letters in the mail, unsolicited letters, offers to buy property. And I usually put them right in the burn pit, but it would be awful easy for somebody to erroneously sign something like that and mail it back, and you would possibly be locked into an agreement that you might not be able to get out of. And so there's a free service offered through the recorder's office here with the Rosemary Brown, the recorder of deeds, property fraud alert, just in case any fraudulent activity would happen on a piece of property that you own, you would be notified by the office. So it's a free service. I encourage property owners to reach out. You can call in the recorder's office at area code 260-248-3106 and ask to speak to Rosemary Brown or her staff, and they can give you more information on this program. And I encourage property owners to sign up as I have done for this. You have nothing to lose and everything to gain. So can't really put it on YouTube, but it's a cardstock flyer here. It says property fraud on a house, and it's red and blue. Very nice flyer.
Okay. And I have nothing to add, so at this time I'll adjourn the meeting. Thanks for coming.
I was